This episode of the Folding Towels podcast is brought to you by Hygiene Australia. Did you know that oil retention in towels isn't just gross but can be a fire hazard? Hygiene Australia have worked with the health and wellness industry to develop cleaners and laundry products that are guaranteed to remove oil residues from your towels so that they feel and smell clean, last longer and reduce your risk of laundry fires. Listeners can get 15% off their next order when they visit hygieneaustralia.com.au and use the code 15OFF-FOLDING-TOWELS.
Everybody, it's Jackie here with the Folding Towels podcast, and we have a special guest today. I'm super excited to welcome Amy Tyler from the Institute of Oncology Massage to our podcast today. Hi, Amy.
Hi, Jackie. How are you?
I'm so good. I'm super excited to chat with you. This has been a long time coming. We started to organize this in 2023, and it's now 2024.
I don't know how that happened.
No, you blink and you miss it these days.
Absolutely.
Yeah. So you are located in northern Sydney, I believe, for those of you who've not heard of the Institute of Oncology Massage.
I am, well, I suppose my clinic is in the north of Sydney.
Yes.
But Institute of Oncology Massage is a virtual platform. So I can reach anybody in Australia, no matter how rural you are.
That's right. Okay. So because you actually see clients on the table in your clinic, and that's Northern Sydney, and then you do some online teaching. Yes, of course. Everybody's online now. So to introduce you, Amy, you are a remedial massage therapist who actually specializes in working with people who have a cancer diagnosis. And I was reading that you love to create connection for the mind and body through integrating oncology, scar, and lymphedema massage to give confidence and new levels of freedom back to your patients. So I think that's off your website somewhere.
That's correct.
Yes. But you actually have like more than 20 years experience in this particular field, don't you? So tell us, who do you see? What clients do you see?
Well, I came straight out of high school into massage, and I have no plans of giving it up. I absolutely adore it.
Wonderful.
And obviously, like everybody, kind of started with anybody and everybody, but wanted to be on the medical side of things. So I somehow kind of fell into the cancer side of things, I suppose, very early on in its kind of heyday in Australia. So I did a sports therapist diploma after my diploma of remedial. And last day of clinic, my patient didn't turn up and I got called into an exam to be a body on the table in a lymphatic drainage exam. And the college was doing diplomas of lymphatic drainage for mainly lymphedema management. And I got this massage and was like, I think this is me. I think this is where I'm supposed to be. So I signed up.
You fell into receiving a lymphatic massage and you thought, wow, this is awesome. I love it. I want a bit more of this.
Yeah. So literally that day, finished my diploma of sports therapies and signed up for a diploma of lymphatic drainage. And I think my family a bit like, again, really? But I found that back then I'd been taught not to work with cancer patients. And then, of course, I'm being taught that every patient I'm going to get my hands on has probably had a cancer diagnosis.
It's changed a lot over the years. Definitely before coming into the 2000s, we had a very oh no, you can't touch sick people and you can't work with sick people, or you have to have a very specific medical degree to work with anyone that's got any kind of, oh, that's such a horrible diagnosis. Like there's just such that, gosh, what's the word? Like people just have that aversion to, oh, you can't do that. But things have changed now, and oncology is actually a growing field for massage, which is amazing.
Or it will be huge. It is a massive industry in the extent that, 1 in 2 Australians are going to be diagnosed with cancer by the age of 85.
Yeah.
That's ridiculous, 1 in 2. So chances are you probably already have somebody in your clinic who has at least had a cancer diagnosis at some point. you might not just have asked the correct question. You might have had on your form, do you have cancer? And they've ticked no, because they don't anymore.
Yeah.
Doesn't mean they haven't had cancer in the past. And, you know, the way things are going, we have such a good survival rate these days of a lot of the cancers. There are some that really haven't changed at all and have low survival rates. But in comparison to, as you say, 20, 30 years ago, we actually now have people living decades post-cancer treatment. And unfortunately, you know, when I trained in my lymphedema originally, it wasn't even recognised by the health funds because they just didn't see it as an issue. It was like, well, there aren't enough people with it. But, you know, now we have survivors. We have lymphedema in society.
Yeah.
So actually now it's become an issue.
And that's one thing that I've really noticed over the 12 years or so that I've been massaging. When I first started, I mean, I didn't know, before I did my diploma, I didn't know what lymphatic massage was in any way, shape or form. And when people were coming to see me and they'd say, oh, I've heard that, you know, you can do lymphatic massage. And I'd be so surprised. I'm like, oh my God, someone else has heard about this. Like, it was, you never got asked. And now, like, that's actually one of the areas that I niche in. And I love when I get the questions because, you know, it's like, oh, finally people are talking about this. It affects everyone almost, and people are actually talking about it. There's been so much change and development, and as I said before, that growth in oncology massage, I'm really seeing that growth in lymphatic massage, anecdotally of course, but I do think those are two areas across Australia that we're seeing a massive increase in people wanting those services.
Absolutely. Well, with all the cancer survivors that we are getting, we actually have lifelong issues. And the longer they live, the more issues we find because, you know, if somebody only lived 10 years post-diagnosis and treatment previously, we didn't get issues that were 20, 30 years down the track. They didn't exist because the patients had passed away by then.
Yeah.
Now we're getting people living into their 80s or whatever who have had a diagnosis in their 20s, and they might hit 60 and have some random complication that was maybe a byproduct of their cancer treatment that is a late-term effect. So we're going to be seeing more and more people who are seeking out, as you say, lymphatic drainage massage and oncology massage, and my other specialty being scar massage, because these long-term effects affect our quality of life.
Yeah.
And that is where people are like, living isn't good enough.
Yes.
We need to live well.
Yeah. I want to be as happy and as healthy and as pain-free as I can possibly be. Yeah.
Absolutely. So that's where we can do a lot of different, I call it different types of oncology massage. You know, oncology massage isn't a technique.
Yeah.
It is a concept, I suppose, because you've got so many different types of cancer. Cancer is just not one disease. We've got so many different types of treatment. So everyone goes through a different treatment. And then we've got people who are in treatment phase, coming out of treatment who kind of need the rehab. And then we have the survivors or the thrivers. And then we have the palcare and the end of life. And they're all different types of phases that we need to adapt our treatment for. So we really need to modify and kind of our style changes throughout that time frame for all of those patients. So
that makes a lot of sense to me. So can we talk, you've already mentioned this to me, but can we talk about your journey with cancer? Because you have actually got a story yourself about being diagnosed and then treatment and recovering from cancer.
Yeah, so I mean, officially, meningioma, so what I had, a brain tumour, is a benign, so not spreading and therefore not necessarily classified cancerous.
Mm-hmm.
However, they still bracket brain tumours, whether they're benign or malignant, under the cancer bracket.
Right.
So mine was randomly found. It was kind of pre a lot of symptoms. It was early days. I was extremely lucky. I was actually already an oncology massage therapist at the time as well. But I got my diagnosis and just felt kind of like I do today, totally fine. and had to close up my clinic with about, I think it was 4 weeks notice, from diagnosis to doing all the tests to having surgery. So
right, that's very fast.
Absolutely. And this is the thing, once people are on kind of the diagnosis treadmill, it is quick.
Yeah.
You really don't have time to play around and say, oh, well, I might just do this instead. You're like, no, this is when your next appointment is medical professional. And then you'll go for this test. Then you need your results at that person on this day. And you just do what you're told.
Yeah.
And then, for me, it was like, well, surgery's booked in on that date. And I was like, oh. And knowing full well that I didn't know how long it would take for recovery. I couldn't work for at least 3 months. But they said, massage is pretty physical. You may be out of it a lot longer. And
right.
I was out. I set my clinic up about 17 months after surgery again, and came back to massage because that's when I had the energy to work full time.
So you had nearly 18 months off work. Wow.
Yes. So
that's a long time.
It is. I did have an admin job 2 days a week. So I started off just a couple of hours there and then built it up to my 2 full days. That was at about the 3-4 month mark, but that is all I did.
Right.
And then got back into massage at about the 17, 18 month mark, and knew it's 100% where I needed to be. So yeah, it is a long time. And people, I think until you experience something like that, you can't quite understand how much it affects. And I still have fatigue issues, 13, 14 years down the track.
Right.
So I still have leftover side effects, long-term side effects from that, and need to adapt my life around that. But I do that fairly well. I work 5 days in clinic and I teach people on the side as well. So,
well, honestly, you do sound very busy.
Life can be hectic sometimes.
Oh, absolutely, it can. That is, I'm a little bit surprised about that length of time, actually. I mean, I'm not saying that this was a minor surgery or anything, but that seems like a long time, 18 months, to really want to come back to work. Yeah.
I think if I was doing a seated desk job, I would have gone back full time a lot sooner.
Right.
But our job's physical.
Well, that's what I was going to say. Yeah, it speaks to how hard we really do work as massage therapists, doesn't it? Yeah.
Absolutely. I could have sat down and just typed away at the computer doing data entry. That wouldn't have been an issue. I didn't have to use my brain too much for data entry. So, I was working in a medical environment. I was doing a lot of billing and things. So I just have to look at something that somebody had. I knew the numbers that would go into the computer for that surgery or that treatment or whatever they'd had. I just pinned that in, and that didn't take up as much energy.
Yeah,
it took up enough to begin with. 2 days a week was plenty.
Yeah,
but as brain power came back, it was the body fatigue. And massage is, even if it's a gentler massage that you're doing, still takes it out of you.
Yeah.
Yeah.
So can I ask, have you, I'm sure there was, but have you learnt anything by being on the other side of the massage table, so to speak, from that experience?
Absolutely. And I did go and have oncology massage at that time, I can tell you. I practiced what I preached. Yes, I have learned a huge amount. And I think, gosh, we get told, people have an operation, give it 6 weeks. Oh, now that I know about how long it takes for scars to actually form, how different surgeries affect the body in different ways. And I believe that when people are undergoing chemo and radiation, it really slows down the healing process. So you might be out of treatment, but it lingers in your body for quite a time afterwards. And everybody is different in how that occurs. So when people are told a generic time frame, often I find in cancer care, it is very underestimated.
Right.
Just having a hip and a knee replacement, we're pretty good at going, at this time frame, you'll be up and walking. At this time frame, you'll be totally fine. At that time frame, you go back to work. And look, generally, that's pretty much how it runs. we'll get the few whose scars don't heal well and need additional care, might get an infection, but generally our timeframes are fairly set. In cancer care, I just find that people are very much given a shorter time frame for healing, and they think that that's what should be the case. And then for them, it's not. And it's almost like, oh, is this as good as it's going to get? And then it's a bit disheartening. And then when they start to see a therapist who is working on the other side of, post-treatment phase, and you're saying, oh, no, pretty much like most of my patients say the same thing. They're like, oh, okay, so this is not just me. And it's that question of, well, why was I told that? And you think, unless you've experienced it yourself, I think the doctors are on such a fast treadmill themselves. They've got so many patients to get through. They have a set amount of time with each patient, and they've got to divulge huge amounts of information, quite emotional information. So unless they physically had a diagnosis themselves, I think sometimes getting into all that aftercare stuff is just like, you know what, I'll leave that to you guys. This is my scope. And so I think sometimes they kind of get either the incorrect information or it's misunderstood information.
I think that's one of the wonderful things about us as massage therapists is we can really take time. If we want to book a 2-hour appointment with our client, if they're happy to do so, and they might only want 45 minutes or an hour massage, but if they need that longer time to get in and out of the table and, particularly if they're a little bit older or what have you, unwell, we can actually really spend as much time as we want to or we need to. We don't have to have people in and out in 60 minutes. Like, we can really delve into how are you actually feeling today? What do you need? I gave one of my clients this week permission to turn down playing a sport.
Oh, nice.
Yes, because I could see she's sitting there in front of me and she's saying, oh, I've got this thing coming up that I really want to do, but I've been asked to play a sport as a fill-in. And I could see her little mind ticking over and going, oh, I really don't want to do this. And I said, are you actually wanting someone to tell you that it's okay to turn this down? And she's just like, maybe. And I'm like, I'm right here to tell you now, if you don't want to do that, that's totally okay. And I love those moments with my clients where I'm like, it's okay for you to actually put yourself first and turn something else down and say, hey, look, that's just not for me right now. Or I don't have the brain bandwidth to do that. Or, I really have to prioritize something else.
Yeah. And we get that time, as you say, to have the conversations. A lot of my patients will be dead silent and half asleep, or fully asleep and snoring. But then I've got the others who, especially the ones who are out of treatment, because they have got a little bit more energy. They've seen you for a while now. You've built up a good rapport, and they get a bit chatty.
Yeah.
And, they'll say things like, oh, I get so much more information out of you. And I'm like, well, yeah, because you got me for an hour. And if you ask me questions for an hour, I'll answer them. And always within your scope of practice, obviously.
Yeah.
But when you're talking about the way the body heals and how the treatment affects their body long term, sometimes they just can't get that additional information from their medical consult because they only have a short period of time and they have to touch on other things.
Yeah. I think with the medical professionals, meaning GPs and specialists and so on, not to say that they're not doing a fantastic job, because I fully am in awe of anyone that goes through medical school, like completely in awe. But they have a little bit of a narrow bandwidth of things that they talk about, and they don't understand massage. Like most GPs, most doctors of any kind, they really don't get what we do.
Absolutely. And that kind of brings me to you had a beautiful podcast on do I get a letter from the doctor?
Yeah.
And that's something that comes up on Facebook. And I just kind of go, well, sure, if you want to, but it's not going to support you in court, because the doctor is writing that thinking that if you're providing this treatment, you are qualified to do so. And if you're not qualified to do so, that letter is not going to cover you.
Yeah.
So
It's such
yeah,
a controversial topic, that one.
absolutely. And
Yeah.
you know, as I say, you can get the letter. If you need that, that's fine. But at the same time, that doctor knows nothing about massage, and they know that the science says, oh, oncology massage is perfectly fine for cancer patients.
Yeah.
But are you an oncology massage therapist or are you not? Because if you
Yeah.
are, you shouldn't be asking a doctor for a letter because you're fully qualified to know what to do. But if you aren't one, that letter is assuming that you are.
Well, I personally, this is my personal opinion, I think that people should really, maybe, not everybody, but most people should be niching into who they want to see. And their social media and their website should say, I see XYZ type of client. I see oncology people. I see pregnancy people. I only do lymphatic drainage. Whatever that particular thing is, that's what you should be putting out to the universe. And then you'll get that back. Because if you only want to do lymphatic drainage, then that's what you should be, the clients that you should be getting.
And you know what? If you do niche and you have all those details on your website, it's interesting how I get patients through the door who say, I noticed on your website you only mention those things. And so I just felt like you were the right person because this person over here did this, saw all those other people, and I just didn't feel like they special. So even though they know their stuff, they're going to be great therapists, it's just because that's all I do.
Yeah.
People kind of see it as a benefit to come to you.
Yeah. And even though, this conversation happens around pregnancy specifically a lot, because obviously pregnancy is not an illness. But if you are seeing pregnant clients, that you are niching into that. And I honestly believe that you should be doing that training that's going to give you those specialized skills that is going to allow you to see those people confidently. And there are people out there, massage therapists, different body workers, that go, oh, you know what? I don't want to work with this specific cohort. And it's funny that you mentioned right at the beginning that you'd always wanted to work in the medical field. I was in massage school saying, I do not want to work in a hospital. I don't want to work with old people. I don't want to work with sick people. I'm very sensitive, and I don't like the inside of the body.
Yeah.
And that's why hospitals give me a lot of anxiety and freak me out. Nothing against those specific people. It's just I can't cope with that type of situation. And it's funny how I still see now, like I have a whole cohort of aged care clients, and I love them, but I see them in their homes. So it's not in a medicalized setting. I don't think I could work in a hospital. It's just not something I could do. Otherwise, I would have gone to nursing school and I'd probably be a nurse.
Absolutely. You see, I always grew up thinking I'd be a physio.
Right.
That's why I wanted to be on the medical side of massage. I'm so glad I'm not a physio, to be honest. I love being a massage therapist, and I looked into doing my physio and just went, you know what? No, this is where I need to be. But yeah, today I spent at my hospital where on a Friday I kind of run my business at the local hospital, and got called up onto the ward. And that's a whole different other story when you're walking into a ward and people have drains and different things attached to them.
It's very confronting.
You don't have a massage table there to lay them down on. You either get them in the hospital bed or in the recliner, and you've got to work around. A nurse came in to take bloods halfway through, and you've just got to deal with all of that. But that's, again, where training comes in to help.
Yeah. We do have that a little bit in the aged care setting. I do come across a few ladies from RDNS and whatnot. They'd be like, oh, I'm just going to take some bloods. I'm like, I'm just going to go in the other room and just check my messages really quickly while you do that, because I cannot, like anyone that's listened to this knows I have a needle phobia. Like I just can't deal with that stuff. So I'd just be in the other room. But yeah, in a hospital setting, it's just magnified. So like, honestly, kudos to you for being able to do that, because that is like just amazing to me that anyone can do that. I'm in complete awe of doctors and nurses. Yeah. Completely.
It's certainly not something I do full time. I'm not going to give up my clinic. I love my clinic space. Yeah. I just think doing a combination of is nice.
Yeah.
It allows me kind of that medical aspect whilst also having the clinic I'm in is very calm, relaxed. It's not clinical at all. It's more of a home feeling, even though it's not.
Yeah.
And yeah, you know, patients love to walk into that and not walk into a hospital for the massage.
Yeah. And do
So I
you get
like
the comments sometimes where it's like, oh, the energy here is just so calm and it's peaceful, and they just it instantly creates this gorgeous vibe of just such amazing relaxation.
yeah, you start it when they walk in that front door.
Yeah. Yeah.
So absolutely. And that is so necessary. You know, these people are running around in and out of medical appointments. They're, you know, doctors are running late because they've obviously had to give somebody prior bad news and it's extended over, and you're now an hour and a bit behind, and your whole life is thrown into chaos. And then my patients say, you know, we come to your clinic, we always know what it's going to be. You're always on time. There's always calmness. There's always nice music playing. It's always a good temperature. Like, we just know.
Yeah.
I think
It's a
that's
safe
really,
space. It's a really safe, secure space for a lot of people, I think.
yeah.
Yeah.
So no,
Yeah.
very important during a vulnerable time, that's for sure.
Yeah. All right, Amy. So tell me, why should somebody choose to do an oncology massage course? What would be the reason that a person gets into oncology?
Well, I mean, honestly, I believe every single massage therapist should have this training, because, as I said before, 1 in 2 Australians by the age of 85 will have had a diagnosis. So that is a lot of people, and you're already probably going to have people in your clinic, and you will guaranteed, I think, in the next however many years, you're going to have people seek out this and approach you for it, just because of the numbers and the fact that we have so many survivors these days. But I think most importantly, the quality of care for the cancer patient or cancer survivor is really important. Massage, we're taught a lot of great techniques. I absolutely love all the techniques I learned in my remedial, my sports. Some of them I can still use on my cancer patients. Some of them I've chosen not to, but I just adapt it so it's appropriate for them. And I think that's the thing is, as I said before, it's not a technique as such, it's more a concept. So it's understanding that cancer isn't just cancer. There's 200 some odd cancer diagnoses. And, you know, chemo isn't just chemo. Is chemo an infusion? Is it orally? Is it topically? They all have different effects on the body. So understanding that radiation therapy, chemo, cancer, they're not just what they're named as. There are lots of different types within that. I think it's really important to understand so you can choose to adapt your treatment to benefit the client.
I have to say, I am leaning towards that opinion myself. I never used to be because, as I said before, that kind of scared me a little bit. The thought that I might have to work in a hospital freaked me right out. But I know when we were talking about it earlier, I was thinking about my own list of clients and was thinking, yeah, I do have some that have been in remission for things. And I do a lot of lymphatic drainage massage in my clinic, and a large percentage of my clients are coming to see me specifically for lymphedema and lipedema. And they, you know, some of them have had cancer previously. So that's such a very true statement, isn't it? That a lot of people have actually had cancer and you might not know.
And, you know, you don't have to go down the path of, if hospital's not for you, that's fine. Because a lot of patients don't want to go back to hospital for their massage when they're let go. It's like, no, I never want to see that place again. You know, we have kind of like the in-treatment phase of cancer massage, oncology massage. And you can, yes, sure, do that in a hospital setting, or you can do it in your clinic, because the patients will be outpatients often through the treatment phase. So they can come and see you. But then we also have like the rehab side of things. So once somebody has had surgery and radiation, they've got a lot of side effects left over from that really need to be dealt with. And that's where we come in. So you might not be looking at kind of the in-hospital stuff, but it might be more the rehab stuff that you want to be a part of. And then, you know, the other option is, as you say, like the PAL care, the end of life. Now, I actually don't do a lot of PAL care end of life because for me, I absolutely love the rehab side of things. I really enjoy the in treatment phase side of things. And often if somebody is in my clinic already, I will take them to end of life. I will never get rid of a patient I haven't already, who I've already been seeing. However, if someone phones up, I prefer to refer them to somebody who does home visits and all that kind of stuff and is happy to do it. That's their gig. My gig is in clinic. So as I say, I'm not going to get rid of somebody, but it just means I don't do as much end of life PAL care stuff because I choose not to start it at that point.
That's a whole nother ball game, really, as well, dealing with everything that happens through palliative care. And again, you've got so many different diseases and reasons that people might be needing palliative care. So,
that's one reason why, for me, my training organisation, we have a diploma of remedial massage as our base training prerequisite because cancer patients don't just have cancer.
Yeah.
Have a whole pile of other illnesses based on that. And cancer treatment causes other illnesses. So, we don't necessarily go into all of that aspect of things. There's a prerequisite requirement that you understand some of that pathophysiology anyway.
Yeah.
To start coming into this because, as you say, end of life comes with its whole new other diagnoses as well.
Yeah.
And you've just got to be able to adapt for that. But that's, a lot of people go, it must be so sad you working with cancer patients. I'm like, no, a lot of my stuff is quite good, actually. It's life-changing for people and, probably 50% of people in a good way. It makes them very grounded, more appreciative of things. They look at life very differently afterwards. The sad part, yes, is when you lose a patient who you might have seen for 4, 5, 6 years quite continuously. That is a challenge, and self-care has to be a part of that, obviously, to make sure that you don't burn out, that you do look after yourself. But as I say, like, you can choose to do oncology massage as your full-time gig, like I do. But actually you can choose to say, I see this niche clientele over here. I happen to be oncology trained. So when someone comes in who's had a cancer diagnosis, who is in my niche, I can still work with them and adapt my treatment for their benefit. And that's where I think you don't need to necessarily specialize in this as your whole goal. But because we're having so many survivors and so many diagnoses, having the training under your belt, I feel, is essential. I think it should eventually probably be part of our diploma training in, decades to come. And I would
the same with the scar tissue course as well. That's only a very short course, I believe, but that can be used, twice a week, for a couple of weeks, and then you might not use it again for 6 months. It's something it's a technique that you're never going to not know, really.
Absolutely. And I started my scar training, years ago because after I did my lymphatic and fell into oncology, well, every oncology patient, well, not everyone, close to, had surgery.
Yeah.
And it was like, this is a whole new thing I need to learn about. We'll learn about that one next.
Yeah. It's like dominoes, isn't it? You learn one thing and then you've got to learn 20 more things.
Yeah, absolutely. Because you don't know what you don't know until you start learning something about it and you think, oh my goodness, this has opened up a whole new ball game.
I know. I wish I had the funds to be a full-time student sometimes.
It would be fun.
Yeah. I'm like, oh, that is fascinating. And I just want to run down that little rabbit hole of information. And then, the week's gone by.
Absolutely. No, I agree with you there. I love learning. I sign up to far too many courses every year. When every time my CPE comes around, I think, no, you're not going to do it this year, Amy. Just do what you need to. And then within like 3 months, I've signed up to like 5 years worth of programs. I've done it again. Why?
Oh, yeah, I know. That happens with me too. So You do run an online course as well, which is Foundations in Oncology Massage. Tell us a little bit about that. You did mention that you do need to have the diploma in remedial massage therapy.
Yeah.
That first, as a prerequisite. That's the word.
So I do a couple of intakes a year. So you come in as a class group, so you get to meet your other people on Zoom. We have the next ones coming up in July and in October. And essentially, you get a whole bunch of pre-recorded content, which you can do in your own time over the 8 weeks that it's run. And weekly, we meet together as a group and we discuss everything through that week's learning to make sure that, number one, you're understanding it, to apply it to certain case scenarios so you know why it's relevant and how to utilize things in clinic. Plus also get to meet your other therapists, because ultimately we're the only people who know what we do. So to be able to network, provide each other with support, and if you kind of gel with somebody, to be able to connect with them outside of the group as well, for ongoing support long term. I think that's really important. So
It's nice sometimes to be able to message another therapist and go, hey, I just have this weird question. Like, I'm not overthinking this, am I? And usually the answer is always, yes, you are overthinking it. You had the right idea in the first place. You've totally got this. So, yeah, I love that about networking. And I do that to David all the time. Like, David, I'm overthinking this, right? He's like, yes, you are. You are, Jackie. Stop it.
And I think it's, I don't know about now, but certainly in the industry when I joined it, networking was not a thing. People saw it more of as oh, you'll take my clients. But now I do feel like it is changing, and it's like, actually, no, we need to support each other. It's good to be able to call another massage therapist, because no one else gets what we do behind closed doors, but we do. So to be able to have that discussion and have that little debrief that we need, whatever whinge we also need, and also get that support, I think is really important, because we're small business owners. We often, we work behind a closed door. No one sees what we do.
Yeah.
Need somebody who understands that.
That's actually one thing that I love about our community is that, we have all these wonderful Facebook groups purely for massage therapists. And it's just a fantastic little community that we have. We have a wonderful Facebook group here in Adelaide. I know there's other local regional groups across Australia, and then some of the bigger groups. But even in some of the bigger groups, like, the community there is just amazing. And you can find anything to do with massage if you have a client, traveling across the country, or a friend that lives interstate. I don't know how many times I've messaged other therapists, say, oh, my friend that lives in Perth or Queensland or somewhere, like, where are you? Like, I want to refer them to you, but I don't know where you are, and all that sort of stuff. So yeah, I love our community so much. Yeah.
Well, I feel even with online learning, that is still important. We need to be able to have that. So thankfully, like, within the course, I have been able to provide that. And, COVID taught us so much. And the fact that, as I say, like, I've said it a couple of times, oncology massage isn't necessarily a technique as such. It's a concept. You've got hands-on skills already. You are massage therapists. Yes, you're going to be taught techniques in it, but they're going to be techniques that you can pretty easily learn, and be able to incorporate immediately. So to be able to do it virtually, essentially give quality education in this industry to practitioners who are as rural as they possibly can be, whilst they don't then have to pay the additional costs of travel and days out of clinic, accommodation, just to achieve their training. And the other thing I've done is combine the foundations into one full course. So you don't have to come back down the track to do another module or anything like that. You actually just run through the course as a whole in one go. And at the end, you're done.
That sounds awesome. Yeah. We will add a link for everyone to your website and to the information about the Foundations program. So we will pop that into the show notes for those of you that are listening. Yeah, I do have one other question for you, which normally we ask this at the beginning of interviews, and I just completely forgot because I was so excited to get started. So I apologize, everyone. Surprise! Yes, and David would probably yell at me, Jackie, why are you asking this at the end? But it's okay. So what is your favorite superhero? Who do you love?
That's a really, really challenging question for me because I've got to be honest, I don't really watch any of those shows. I've never been into comics or anything.
Right.
Yeah, my friends play a game. Let's guess what movie Amy has actually seen.
Oh, no.
So when it comes to like all of those, I've got to say I have seen Superman.
Yeah.
Because one of my friends worked on the Henry Cavill, is that his name?
Yeah, correct, yeah.
And did the puff of dust as he took off.
Oh.
That was his job. But if that puff of dust is
very
there,
specific.
It looks fake. Whereas if that kind of takeoff is there, it looks real.
Right.
So yes, you would, if it was missing, you'd be like, that looks really dodgy. So I have seen that. So I'm just going to go with Superman.
You're going to go with Henry Cavill, Superman.
That's the only one I know, to be honest.
Well, surely you know of Christopher Reeve as well from the 80s movies.
Very true. Yeah. Very true. Didn't
classic.
see any of them, but do know who he is at least.
Oh my goodness. My brain is short-circuiting learning this about you. I'm sorry, because I'm a huge movie buff and I'm just like, how can you not have seen these movies?
I'm a great date in that extent that you can put a movie on and it's going to be fresh for me.
That's good.
So catching up with friends and they're like, oh, let's have a movie night. I'm like, well, I won't have seen it. So you just choose.
Yeah, that's actually a really good perspective. I love that. I actually thought you might have said Wonder Woman. I don't know why, but I was getting Wonder Woman vibes from you. So, yeah.
Well, maybe if I go and watch it, I might change my mind and say her.
Well, you've got the updated Wonder Woman, but also the classic Linda Carter from maybe that might even be the 70s as well, but definitely the 80s.
All right, so I should watch both and compare.
That's not necessarily what I'm saying. I adore Linda Carter. She's amazing. I follow her on Twitter and she is just the most beautiful soul you've ever met. She's just wonderful. Not that I've met her, but she's just wonderful. And I love the old school stuff, the Christopher Reeve playing Superman and Linda Carter playing Wonder Woman. So yeah, I love it. I'm a huge movie buff,
different era, weren't they?
It was, yeah. And you cannot, Christopher Reeve just had this amazing energy. You just cannot, I don't even know how to explain it, but you just watch the movies and it's just he was one of a kind, completely one of a kind.
You can do so much these days with CGI and all the other things. It's the voiceovers and all that kind of stuff. You don't actually have to probably be as good as you had to be back then because the editing couldn't be done back then. Now we can edit bits in and out and do all of this and, change a voice on, synthesize things and all that kind of stuff. And you can play around so much more these days.
In some ways, I absolutely agree with you. But I also think that there are some people that just have that enigmatic charisma, and I think he was one of those people.
They just naturally have it.
Yeah, they've just got something that you just, and again, Christopher Reeve, just an amazing human being, just a wonderful man. Just fangirling all over Superman over here.
Well, lucky I chose that one then.
That's not to say that Henry Cavill is not amazing as well. He is, obviously. But yeah, I just adore the old 80s movies. I love them so much. Yeah. Anyway, we are way off topic now.
Good way to end.
That is. All right. Well, thank you so much, Amy, for coming on the podcast and chatting with us. It has been so interesting to hear about your journey and what you do and all about oncology massage.
It's been a lot of fun. Thank you, Jackie.
Thank you. And goodbye, everybody. We'll see you next week. Thanks for joining us. And don't forget to check the show notes for all of the information about the Institute of Oncology Massage and Amy's business and where you can learn more about oncology massage. We will see you then. And don't forget to send us a message if you have any questions. Thanks, everyone. Bye-bye.